Hi, I'm Cindy Kreider, and I'm a substance abuse counselor at a methadone clinic. I chose to lead a group session on anger management and opened it up for all of our patients to attend. The hour we met could have benefited them in making their monthly contacts. A number of my patients said that they would come to our group meeting, but then for one reason or another, only 2 people showed up. Being such a small group, we met in a circle in my office on Tuesday, February 19th at 8:30 a.m. The atmosphere in my office is warm and comfortable, which set a tone for intimate, relaxed sharing. The 2 members who participated in the group, Melissa and Ashley, both knew each other from their many years that they've attended the clinic, and both happened to be on my caseload. Melissa is in her early 40s. She's obese and has been on drugs nearly all her life. Ashley is in her early 20s and is overweight and dealing with dysfunctional relationships. She's now living and fighting with her codependent mother, who even called her to check up on her whereabouts during our session. I started the meeting explaining the purpose of our group, which is to gain a better understanding of anger and develop more self-awareness and self-control. They understood the norms of group sessions, such as maintaining confidentiality and not being rude or hurtful, so I did not spend much time rehearsing these. The fact that these 2 women knew each other made an icebreaker unnecessary, but at any rate, I still asked them to explain briefly what they learned about anger growing up. I had intended to use this as a comment round with a larger group to get a better idea of where the members were coming from and what their experience with anger had been. Melissa said she came from a family of addicts. Her parents fought all the time. She was also a fighter in school to cover up hurt from being made fun of since she was overweight, which led to her being a loner. And Ashley said her parents split up when she was little, but she can remember her mother throwing a coffee mug at her stepfather. And she says she has a lot of anger inside and lashes out at her mother. For an introduction, I opened the session with a brief story to focus and pique their interest on the topic. This was followed by a question to draw them into a discussion, which I then summarized to wrap up their comments. I followed my outline by presenting short paragraphs of content followed by discussion questions. Melissa had taken an anger management class when she was a young parent, so she was familiar with the topic. She tended to dominate the discussion by jumping in and answering first, so I needed to keep drawing out Ashley by looking at her and asking her, "What about you?" Sometimes I could pull her out with just my eyes, but other times I needed to ask her directly. Melissa kept jumping in and even cut off Ashley at one time when something triggered a thought for her. At another point, Melissa encouraged Ashley to write a letter to her mother, explaining how she feels. She also disclosed how counseling had benefited her relationship with her daughter and encouraged Ashley to consider doing so with her mother. Normally, it's not appropriate for patients to give each other advice, but in this case, it was good advice and was well received. Overall, I felt good about my facilitation of the group, but realized that there are many areas for improvement. My main disappointment was the size of the group. I could not do anything about it at that point unless I was going to go to the highways and the byways and pay someone to come in. So getting over that disappointment of not being able to use rounds, the whole session turned out to be a triad, which worked fine. In reviewing the leadership techniques that I used, I feel like I did a good job of modeling effective communication and listening skills, which created a sense of warmth and safety for group dialogue to happen. I could have cut off Melissa when she jumped in after I asked Ashley what she thought. I chose not to, though, because Ashley did not seem to have her thoughts formulated yet, and what Melissa shared was appropriate. Still, I could have tried to give her less eye contact. I made a point to shift the focus to Ashley when I used reflective listening by saying, "So, what you're saying is that you're the one being aggressive?" Different times during the session, I used questions of clarification, like, so when you hit someone, how did you feel short term? How about the long-term consequences? I also found myself summarizing what they said throughout the session. Now, as far as visual contact, I do not think I did so well with scanning for nonverbal cues, at least not consciously. I tended to engage with the speaker rather than keep my eyes moving. I tended to engage, the women tended to look at me, but there were times when they did look at each other and talk directly with each other. So I didn't need to signal them to look at each other. I tried to use my voice to energize the group and help set the tone by speaking enthusiastically. I read the definitions and input with a lot of inflection so that it wouldn't sound so monotone and would hold their attention better. I used a couple handouts as visual aids to hold their focus and interest. One of them is this definition of anger, which is kind of unique. And another one is showing the iceberg with anger at the top and the primary emotions down below the surface. A few times I held the focus when the members seemed to want to speak into a topic longer. But in order to get through the material, I tried to shift the focus in such a way as to tie together and build on what had just been said. Now, I could have shifted the focus from Melissa back to Ashley by using Ashley's name. When Melissa did not wait for Ashley to respond to me, what about you, Ashley? How did you experience that? Using Ashley's name would have helped to inhibit Melissa from interrupting. As I reflected on the depth scale, as introduced by Jacobs, Schimmel, Mason, and Harville, 2016, I would rate our depth as being around a 5 or 6 on the 1 to 10 scale. This was deep enough to derive some benefit without going deeper than I was prepared to address. Now, I did ask some thought-provoking questions to deepen the focus for Ashley, who was able to share her struggles with anger towards her mother. Overall, I felt good about my experience leading this group. Both women were engaged in the session and seemed to have enjoyed it. Some of my strengths were using reflective listening, summarizing and clarifying questions without conscious thought to do so. I wanted to hear from everyone, not just one member, so I shifted the focus quite naturally. There are things to improve on, though, and to keep in mind when leading other groups, especially larger groups. For one thing, I'll make a point at the beginning of the session to encourage everyone's participation and warn that I might need to interrupt someone at times and not to take it personally. I also need to be aware of how the whole group is doing, not just the speaker, and be scanning the group. I look forward to applying and polishing these skills in other sessions that I lead in order to become a more proficient group leader. Thank you.